Colon cancer screening is very important for two reasons. One is it's the third most common cancer in this country for both men and women. And two, it's preventable. Colorectal cancer starts off as abnormal growths in the colon, which we call polyps. These are small growths that over time will get bigger and eventually become a cancer. Colon cancer screening guidelines were recently changed because there's been an increase in colon cancer in patients under the age of 50. So it was changed from 50 to 45. The colonoscopy is the gold standard for colorectal cancer prevention. And the reason it is because it can prevent colon cancer. This is the only test that can prevent colon cancer. It can identify abnormal growths in the colon that can be removed, thus preventing colon cancer. The other group that's available is the stool-based test, which is the FIT test and the Cologuard test. And these are stool carts that are done. The FIT test is done once a year, Cologuard is done every 3 years. And these tests are very sensitive for detecting colon cancer, but not very good at detecting precancerous lesions. So they can identify colon cancer early and we can treat it, but we can't prevent colon cancer with these tests. That's why my most recommended colon cancer screening test is the colonoscopy. One of the reasons that screening is important is that colon cancer doesn't present with a lot of symptoms until you're later into the later stages of the cancer. So we do recommend screening for everybody, even though you don't have any symptoms. But there are certain symptoms that you should be looking out for, and for those patients should get colonoscopy sooner rather than later. That's significant abdominal pain, new onset constipation that's unexplained, or bleeding. If you notice any of those, weight loss that's unexplained is another one, then I would strongly recommend you talking to a gastroenterologist and see if colonoscopy is appropriate for you. If we can do a colonoscopy, we can find these precancerous lesions and remove them, thus preventing cancer. Even with the stool-based carts, if we can detect cancer early, it's curable. There are treatment options for this that are very successful. So this is a cancer that's curable and preventable. So I would strongly recommend screening for everybody.